Hi, I'm Dr. Paul. Another episode of Ask Your Pediatrician. The question for today is, should my child take vitamins?
Why you gotta hesitate?
I hesitate because it's kind of a loaded question. Here's the thing. I have tested over 1,000 children, and these are all kids who have some reason that they're seeing me. In other words, they're not just your typical well visit. They might be coming in for ADD or anxiety, depression, autism, immune issues, something chronic, eczema, asthma. And in my thinking, I've come to appreciate the fact that if you want to get to root cause, so what's causing your child's illness or chronic condition, and not just give a prescription or a treatment to treat the symptoms, but try to identify root cause. The most satisfying root cause is figuring out that there's some nutrient, some vitamin perhaps, or mineral that's missing. You might ask, well, how could that be? My child eats all their fruits and vegetables. I've read, hey doc, I've read that as long as you eat all your fruits and vegetables, you'll be fine. That's what I was told in medical school too. And I actually believed it for many years in the early years of my practice until I started learning that there's ways to look and see whether or not those nutrients are actually getting into your body. So I use a test called SpectraCell micronutrient testing. It measures the nutrients inside the white blood cells, and I have found out of over 1,000 tests, I had one person whose nutrients were adequate. And I have found in the over 1,000 kids who had some abnormalities, a very high percentage of children, I'd say 60, 70, 80% are low in vitamin D. So I can categorically state that unless you live in a very sunny climate and you're outdoors in the sun a lot without sunscreen on, you probably need some extra vitamin D. So should my child take vitamins? Absolutely. At least vitamin D. Start while you're pregnant, continue right after birth. And then the question comes, well, what about a multivitamin? You know, if you get a good multivitamin that has methyl B12, methylfolate, some of the B vitamins, I often find those to be deficient. Very often I'm finding the element magnesium to be low, or calcium. So a calcium magnesium either as part of your multivitamin or as a separate supplement is not a bad idea either. So where do you start? Where does it end? Well, that depends. Like I said, at least take vitamin D, consider a multivitamin, and then maybe, especially if your child is suffering from any kind of chronic condition, get your child tested. If you can get the SpectraCell micronutrient test, I really love that one. You can do a blood test. It gives you a shot, a moment in time. Micronutrient testing gives you the levels inside the white blood cells, so you get a kind of a view of how things have been over the last 3 to 6 months. And then you know for sure. Sorry I rambled, but I think there's a place for appropriate, targeted nutritional supplementation. Always, always, always remember the best way to be healthy is eat organic, lots of fruits and vegetables, and you'll have very minimal need for supplementation. Well, I hear two questions. So one is there any danger in taking multivitamins? Typically not. Vitamin D you would have to exceed, depends on the age of the person, of course. An infant, I wouldn't exceed 2,000. A school-age kid, I wouldn't exceed 3,000 or 4,000. An adult, I personally don't go over 5,000 international units per day, although you're not going to get in trouble with those levels. People who take mega doses, over 10,000 international units a day of vitamin D, could get in trouble. The one vitamin to be careful about is vitamin A. Too much vitamin A can become toxic and actually can be quite harmful. So some people recommend vitamin A, large doses, short bursts during viral infections. That's been shown to have some value, but be careful. Don't continue that, week after week. That'll cause you some trouble. Most other vitamins, you're unlikely to get in trouble if you're just following,
Basic protocol.
Reasonable assumptions on that. So, to be real honest, the idea that you get all your nutrients from your food, it's a wonderful idea. Unfortunately, much of our food is mass-produced. The soil is depleted. When they put fertilizer in soil, it's nitrogen and phosphorus. It's very rarely are they replenishing, micronutrients like selenium and copper and manganese and, all these various important nutrients. So produce may not have quite the value of these nutrients as it once did. Another thing I've read in a couple studies is that genetically modified organisms frequently have lower nutritional value. And we're seeing a lot more genetically modified organisms or plants, food, entering into our food chain.